Hello, Mr. Blake.
Hi.
How you doing?
Good, how are you?
My name is Vincent. I'll be your nurse today. I'm just here to do a physical assessment on you.
Okay.
So, first of all, can I have you tell me your full name and date of birth for me?
Blake Fodor, September 12th, 96.
Okay, good. So I have a few questions for you. First, do you have any cultural or spiritual preferences I should be aware of?
No.
Okay, and is English your preferred language?
Yes, it is.
And recently, have you had any thoughts of harming yourself or suicide recently?
No.
Okay. And is there anybody else involved in your care, such as friends or family at home?
Just my parents.
Okay. Patient appears to stated age, is groomed well with no dirty clothes, and shows good hygiene with no foul odors. All right, Mr. Blake. Have you had any trouble with your vision or hearing at all lately?
No.
Okay. And do you have any numbness or tingling anywhere?
No.
How would you say your ability to swallow is?
It's fine.
No trouble?
Yeah, no.
Okay.
No trouble.
All right, and I'm just gonna check your ears for any drainage or leakage. Can you tilt your head back for me? Could you open up your mouth? Could you tilt your head to the right for me? And patient shows no drainage leakage from the ears, nares, or the mouth. Could you pull your eyelids down for me like that? Conjunctiva is pink and moist, sclera is white and moist, and there's no drainage from the eyes as well. I need to check your pupils, so if you could look at me between my eyes. I'm going to shine this in your eyes twice. Okay, and if you can look out the window for me, on the count of 3, I want you to shift your vision to the top of my pen and follow with your eyes as I move it closer to your face. Ready? 1, 2, 3. Good. Patient's pupils are equal, round, and reactive to light and accommodation. Mr. Blake, could you make a few funny faces? Can you give me big smile, big frown, raise your eyebrows, puff out your cheeks? Good. Patient shows facial symmetry and there's no drooping. Could you also tell me again what your full name is?
Blake Fodor.
Could you tell me where you're at?
Our Lady of Lords.
And could you tell me what year it is?
2019.
Patient is awake, alert, and oriented to a person, place, and time, and the patient's speech is normal with no slurring or no stuttering. Could you hold your hands out like this for me? Give me a good strong squeeze on my 2 fingers. Hands out straight, don't let me push them down. Same thing with your right leg, and I have it up. Don't let me push it down, and with your left leg, same as well. Good. Patient shows bilateral grip strength and a 5 out of 5 muscle strength on the upper and lower extremities. Mr. Blake, have you had a cough at all?
No.
Any trouble breathing?
Nope.
Okay, and I'm just going to take a listen to some of your lung sounds.
Okay.
If you can give me a deep breath in and out. And again. 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 Good. And if you can sit up on that side of the bed for me with your legs over that fold. And same thing, deep breath in and out. And again. 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 And last one. Good. And you can lay yourself back. Patient shows symmetrical chest rise. Respiration rate is not too fast or too slow. Patient does not show any adventitious breath sounds such as rales, ronchi, or wheezing. And Mr. Blake, have you had any chest pain at all?
No.
Do you feel any lightheadedness or dizziness often?
No.
Okay, and are you easily fatigued?
Not really, no.
Okay, and when you're doing activities through the house, such as going up and down the steps, do you feel like you need to catch your breath often?
No.
Okay, do you feel oftentimes your heart flutters or has any palpitations?
No.
Okay, and I'm going to take a listen to some of your heart sounds.
Okay.
First, I'm going to start at the aortic pulse, and then the pulmonic, Erb's point, tricuspid, and the mitral. All right, and patients' heart sounds show normal S1 and S2 rhythms. It is not too fast or too slow, and there's no signs of murmur. Could you hold your hands out like this for me? I'm checking for capillary refill. It is below 2 to 3 seconds, and there is no clubbing, there's no central cyanosis, and no diaphoresis. Could you have your palms up for me like this? I'm taking the radial pulses, They are a +2 and symmetrical. Have you had any pain in your legs at all?
No.
Any tenderness in your calves?
No.
Any pain when you do any strenuous activities?
No.
Okay, and if you could hold your arms out like this again for me, I'm gonna do part of the integumentary assessment with the temperature. Temperature is warm and consistent throughout, and I'm going to test for capillary refill. Ooh, on the toes. I'm sorry. And capillary refill is below 2 to 3 seconds, along with no clubbing. I'm also going to take the pedal pulses. Pedal pulses are a +2 and symmetrical. I'm going to also do the temperature scan assessment. It is warm and consistent throughout. On the upper and lower extremities, the color and the hair distribution is consistent and consistent with the patient's race and or ethnicity. I'm also going to palpate for edema. Patient shows no pitting edema. And Mr. Blake, have you had any nausea, vomiting, or diarrhea recently?
No.
Okay. How often would you say you have a bowel movement?
Once a day.
Once a day?
Mhm.
And when was your last bowel movement?
Yesterday.
Okay. How about your urine? How would you describe the color of your urine?
Yellow.
Okay, and do you have any pain with any of those?
No.
Okay. And I need to inspect your abdomen, so if you could pull your shirt up for me. I'm going to inspect from different angles. There are no ostomies, the umbilicus is midline, and there are no tubes or drainages anywhere. I'm going to auscultate for bowel sounds starting at the right lower quadrant. Bowel sounds are present to the right upper. Those are present, left upper. The sounds are present and the left lower. Sounds are present. Okay, Mr. Blake, do you have to go to the bathroom at all?
No.
Do you have to urinate at all?
No.
Okay, I'm gonna palpate to see any abnormalities. And I'm gonna palpate your bladder. Patient's bladder is not palpable, and there are no palpable masses, hardness, or any distensions within the abdomen. You can put your shirt back down. And Mr. Blake, have you had any history of skin conditions at all?
No.
Okay. If I could have you turn over for me. I'm looking at the bony prominences such as the hip, the shoulders, the elbows, the heels, and the back of the head. There are no signs of skin breakdown. Okay, Mr. Blake, can I have you come back over? I'm going to assess for skin turgor. So I'm pulling and pinching the skin. Patient's skin rebounds immediately and there's no signs of tenting. I've already done skin and hair and color assessments during the peripheral assessment. And Mr. Blake, have you do you use any assistive devices when moving around the house at all?
No.
Okay, and do you use furniture at all to move around the house?
No.
And do you have any joint pain?
No.
All right, and I'm going to do range of motion. So can I have you sit on the edge of the bed for me? So I just need you to copy my motions as I do. Raise your hands straight up, hands straight back, hands touching behind your back, and then hands touching behind your head. Can I have your right leg straight out from like this and back down? Sorry. Left leg up, back down. Put them both up just a little bit. Point your toes like a ballerina, and then toes toward your head. And you can relax. Patient shows range of motion in all points. And I think that's it for this physical exam. Thank you very much, Mr. Blake.
Thank you, Vince.
I'm going to take my time with whatever time I have left to think of anything else I need for this physical assessment. And I believe that's it. So, Mr. Blake, thank you very much.
Thank you very much.
Okay, take care. It's nice meeting you.
Have a good one.